I'm Penny. I've been a GP for probably 40 years and I've been visiting Maningrica for about 10 years. First time I came, I thought this is medicine that is so different to anything I've ever seen. Conditions that we read about, learn about, but actually never see. Until I started this, I had no idea how there could be medicine that presents in a manner that is just totally different to what it's like in the urban world. The benefits of it for me are fantastic because I've actually found a model that gives me purpose as far as my work goes.
I'm Kerry McHale. I've been a GP since 2011 and I've been working out here in Maningrica for about 4 months. I've done remote work before and really enjoyed it. It's something I was interested in doing again. I'm married with a 2-year-old son. I obviously didn't want to be away from my son for extended periods of time. They made an arrangement with me so I could come out 2 or 3 days per week, which means I'm only away from my son for 1 or 2 nights. The work out here is exceptionally challenging at times, but extremely interesting and very good for learning. You see a spectrum of disease that you just won't see in your urban GP practice. I think professionally it challenges you and it makes you a better doctor.
Now, the way patients present in a community like this is a bit different to what happens in an urban practice. I mean, people tend not to have appointments. I'm seeing sort of medicine I've never seen before. And then there are all the tropical diseases that are peculiar to this part of the world, like melioidosis. I mean, the exponential growth of my knowledge is amazing. The other thing I love about coming to Maningrica is it's a great team.
The team here is amazing. The people that work out here are extremely dedicated and hardworking, and they're very well skilled.
The reality is the really tough, hard stuff, first-line stuff is done by the nurses, and the remote nurses are an amazing group. There is a lot of support, and I think that's really important, and it works really well here. I had never really considered working in Aboriginal health or in remote areas because I thought probably that I don't have the skills to do it. You know, I just thought well, it's going to be too challenging. What I've learnt now is that I certainly don't have all the skills, but no one's got all the skills. I mean, that's why a team's so important. I think if anyone's thinking of coming, I'd hugely encourage them to give it a go.
You can have a little taste. There's always locum opportunities to just come out and see how you like it. They can be quite flexible with the arrangements.
If you're confident and competent, leave your ego at home, come for a short time. I would like our Indigenous Australians to have access to medical advice and help so that they would be able to see the same doctor, come to a clinic that was well set up. All I want to do is actually provide the sort of care that I did for people in an urban environment. It's a really simple aim. I actually just want people to feel better when they leave as opposed to when they came in.